Medical error is our third leading cause of death, right behind heart disease and cancer. That, for me, as a clinician, is unconscionable. It's not because clinicians don't want and strive every day to deliver the best possible care. In healthcare, we have never thought about how do you track and trace care, products, care outcomes in airlines or in other sectors. They have the infrastructure to track and trace things. That's what those sectors know as supply chain. What health systems are even thinking about supply chain tools and approaches to improve quality and safety and performance? I found only 3. Every one of those systems had a very clear vision that the basis for doing this was to create a much safer health system and a system that is actually sustainable. If you have a safe health system, you have a less expensive health system because the cost of error is very, very high. The inventory costs of healthcare are so high. As soon as you put in a tracking and traceability infrastructure, you immediately achieve a return on investment. When surgeons and clinicians start to see what outcomes they're getting for what processes of care and what types of products they're using, they're almost immediately finding ways to deliver better care, greater quality, with much greater efficiency, which allows them now, for the same amount of money, to deliver more surgical care with the same number of staff. In the 3 systems, they are reporting much lower rates of very critical incidents called never events. I can go get a pacemaker put in to help regulate my heart rate, and I have no idea as a patient who made it, when, what lot number, batch number, and if it gets into trouble and that company has to recall, which happens, we today have no idea what patients have that pacemaker. And it's not just pacemakers, it's implants, it's medications, it's every product. So it's a game changer in terms of system infrastructure that gives the clinicians and teams the tools to ensure very safe care, but gives them the data sets now to look at under what conditions do we achieve the best outcomes, how do we learn from that, and how do we achieve even better outcomes.